So the topic is beta-caryophyllene, a cannabis alternative or an adjuvant? Which one is it? And I'll tell you about what I've come to determine. So first off, you've got my history. I was West Point, 1972. When I retired in 1997, I took up a few jobs. I went into employee health for about 20 years, but then evolved into Elixinol as a consultant in 2014. And I've been working with them until 2020 when we separated. And I formed my own company, Blair Medical Group, which is offering beta-caryophyllene beta BCP plus as an adjuvant. And I've learned so much from my individual patients. It's incredible what I've learned from it because you cannot find this much information in the literature on BCP. So I'm the CEO. I'm an author. I'm a joint partner with Laurel Crest Labs that produces BCP products and CBD products and cannabis products as well. And I have my book. It's available on Amazon. It's expensive, but it does offer a unique process and a unique aspect of medical care, especially for clinicians. I do have another book underway that appears to be something that I will be able to have out in a short period of time. I'm having some slide issues. Yeah. So the book is going to be about beta-caryophyllene, and it should take about 3 months in order to produce the book. I'm hoping that it'll come out as soon as July of this year, but I don't know how that will work. I'm going to author it with Kylie O'Brien. Again, she was a fabulous author and co-author for the first edition, where I'm going to be contributing most of the case studies for the particular revelations that I've had. So this is my agenda. What is caryophyllene? How does it work? Cannabis comparisons, the synergy that these two molecules have together. And then I'm going to go into some special topics about BCP because I think it's important to focus on the particular benefits of these things. So what is caryophyllene? Well, it's an essential oil. It's common in many spices. It alleviates pain, inflammation, anxiety, and metabolic disorders. And that's a sort of general topic area. It's been found in thousands of plants, literally thousands of plants, like cloves, hops, avocado, hemp, and I'm getting a slide preparation here. This moving forward, and I don't want it to move forward. I want it to stay where it is. So one of the features is it's got high concentrations in 36 species, including hemp, and there's over 3,300 PubMed articles on it. And it's FDA approved as a food flavoring and a topical agent. Now, one of the particular studies, and this is a study that was done on the entourage effect, and it discusses all the entourage, all of the chemicals, but the conclusion was that in cannabis science, terpenes play a substantial role, but have been overlooked. Beta-caryophyllene is the most represented terpene in the ECS therapeutic research. It's representing as much as 35% of cannabis essential oil. So it's generally been ignored, and the science hasn't really been there in determining what this molecule offers. In fact, there's some suggestion that some of these terpenes may be acting better than some of the primary cannabinoid substances. And what about the Mediterranean diet? Now, it turns out that most of the Mediterranean diet may be because the benefits of the Mediterranean diet and its healing effects on neurodegenerative type of problems and health issues, obesity and diabetes, may be related to its endocannabinoid stimulation. And there's a couple different processes that are going on here. First, there's CB2 receptor agonists that are activating this particular receptor and increasing the number of receptors that are available. For instance, olive oil actually increases the number of CB2 receptors. And of course, we've got beta-caryophyllene. And there's a compound that is unique that is also a stimulant. It's available in other foods. It's diindole methane, and it's found in broccoli, cabbage, cauliflower, and horseradish. So this is another CB2 agent. Now, we also have fatty acid amide hydrolase inhibitors, and they come in the form of red clover, peanuts, chickpeas, and then there is a camphorol, which is a flavonoid that is distributed in leafy vegetables as well. And it acts as a fatty acid amide hydrolase. And that inhibits the breakdown of the endocannabinoid substances, so it elevates their level and rebalances the program. Now, their dietary omega-3 and omega-6 play a major role in the inflammation and the anti-inflammation and the recruitment of other neurotransmitters and endocannabinoids in the body through the omega-3 and omega-6 process. And we talked about the CB2 receptors in particular, but these substances are available in so many different foods. And I think that in general, that the CB2 receptor has been overlooked as being the major benefit of cannabis. Now, safety and toxicity of beta-caryophyllene. Look, there's dozens and dozens of studies that look into it. Over 500 milligrams per kilogram, which is an enormous amount. That's enough to drown a rat, much less take it as a dose. And that you're not going to get a toxic effect until you get up there. But included in all of these things, where it doesn't cause any irritation to the lungs, no skin irritation, no toxicity, no behavioral changes, no histologic changes. And with regard to the CYP 450 system, it has a non-competitive inhibition that did not interfere with any drug metabolism, amazingly. But what I really want to point out is that there have been no reproductive effects on conception, gestation, or ovulation with beta-caryophyllene. In fact, it works as an anti-mutagen, preventing DNA damage by mutagens, as well as desmutagens and bioantomutagens. And these are substances that can change the epigenetic and the formation of the mitochondria, of the DNA molecules in the process. But it has all of these features, which is extraordinary. But there have only been 10 human studies on it. Just 10 human studies. And yet almost every one of these, of the 3,000 articles that I've reviewed, well, probably about 1,000 articles, has talked about, boy, this needs to be studied more. But they haven't done it. There's been no, they're just 10 clinical studies with a massive amount of information, and it's been around for centuries. So it's amazing that it has not been produced in a bioavailable and a more effective manner and incorporated into our scientific studies. Well, how does it work? And how does CBD and beta-caryophyllene work? Because they work almost in parallel. The endocannabinoid system consists of 11 and 12 systems, counting the endocannabinoid system. And it works on all these systems as a signaling molecule. And I think the best way to describe it is a signaling molecule. It's a molecule that certainly has metabolic capabilities, but the signaling capabilities are phenomenal with regard to it. It's affecting everything from receptors to enzymes to transport molecules, genes, cytokines, adhesion molecules, and cell death proteins. It's affecting the whole body in an elaborate, complicated system that's integrated wholly with our well-being and our homeostasis. And BCP fairly parallels what happens with CBD. Now, I have this platform I like to get on, is about CB2 receptors. So often in the old literature, they talk about CB2 receptors being in the periphery. Yes, it's in the periphery. It's on every one of our immune cells. There's no question about that. But what is overlooked is a CB2 receptor in the CNS. It has a very prominent role in the CNS. It's just doesn't have as many receptors as CB1, but for that reason, it's been downplayed and overlooked, when in fact, the CB2 receptor is in all of these brain areas that are listed on the left. Incredible, the number of connections that it has, and it controls so much of our behavior and our neurotransmitters and our well-being just in that way. Now, here's CBD, and I listed off a simple slide hitting the main targets of CBD and where it hits the body. And, I've got like 20 different specific targets. And so it's very pleiotropic. It's got an amazing number of combinations. It works on metabolism. It works on immunity. It works on neurotransmitters. All of these systems it's effective at. Well, and it particularly noticed that it's a CB1 inverse agonist. So it's got a questionable response to CB1, but I think we've seen in the literature and in the evidence that it actually acts as a deterrent to the CB1 activation in the brain and specifically. And the CB2 receptor is a weak receptor. It definitely works through the CB2 receptor, but it's a weak receptor. And the GPRs are fundamental in its function, and they're an exception to the combined effect of BCP and CBD. Whereas beta-caryophyllene has almost all the same targets, with the exception of the GPR receptors and the CB1 receptor. Otherwise, they're almost the same, except that beta-caryophyllene offers not only fatty acid amide hydrolase inhibition, but it also offers MAGL, a monoamine glycine inhibitor. And so that's preventing the metabolism of 2-AG as well as AEA. And so that could mean that it enhances the endocannabinoids specifically for the body. And the other area where beta-caryophyllene is unique is that it's a PPAR alpha receptor. In addition to PPAR gamma, it's a PPAR alpha receptor agonist. Now, what does PPAR alpha do? Well, it's key and important for glucose metabolism and lipid metabolism in particular. And it's a genesis, it formulates much of the genesis of ketones bodies, and it has a lot to do with cholesterol synthesis. And so these have a major role in the body, and it could mean that why this is differentiated it differentiates itself from CBD. So I put this slide together to make some comparisons, and both as synergy and as separately. So on the left, I've got the beta-caryophyllene and CBD synergistic. Now they've got direct agonist and antagonism effects. They've got indirect, and they work on the endocannabinoid system, neurotransmitters, and the signaling. But CBD is really famous for its epilepsy, its pain, its sleep, its Alzheimer's and Parkinson's disease reversal, brain injury, wound healing, and cancer. But it has some negatives associated with it. Can be some anxiety related to using CBD. There's no high effect. Although some people do report a feeling of lightheadedness with it. Interactions are rare. There's a drowsiness, dry eyes. These are trivial, but they can be positive. And the final one is that you can drug test positive if you're using a combined, a blended factor with THC, if you're using a full cannabis, full spectrum product. So it can be a hazard for many people. Whereas caryophyllene is particularly immune and metabolic, but I also emphasize that it has neurotransmitter effects very specifically. It has benefits with regard to vision, anxiety and depression, allergy, addiction, weight loss, and metabolic, cancer. But I want to focus on these particular items. It has all of the benefits, as I see it, of cannabidiol, but it offers these particular areas of focus that can make a difference for everybody's health. And that's where I see it in the synergy with cannabis. Now, the first study I have for you is a pain study on animals where they compared the animals to CBD and to beta-caryophyllene and then combined. And when there were comparable levels of analgesia for CBD and beta-caryophyllene, but when they were combined, we had a decrease in an improvement in the effective dose by 27%. So that you were able to reduce the milligrams per kilogram dosage and get the same level of benefit. In fact, a greater level of benefit according to this graph. And in ischemic brain injury, in a stroke situation, using beta-caryophyllene and or CBD led to decreases in infarct size. But the beta-caryophyllene led to shallower but broader damage, but CBD treatment led to a narrower but deeper infarct. Together, they showed decreased range of damage, and they both directional effects were protective and were mediated by different mechanisms. So the combined effect appears to be a great deal to do with synergy. And that image on the right shows you the depth and the small size of that infarct compared to the other cases. And then this is a case of breast cancer model that was used as a full spectrum, well, it's a broad spectrum cannabis, the Philena 32 hemp is a broad spectrum agent, doesn't contain hardly any amounts of THC, but it was combined with the full entourage effect of the other cannabinoids and beta-caryophyllene, and they found remarkable results from it. They found that beta-caryophyllene and beta-caryophyllene has a breakdown product that is called caryophyllene oxide. And oftentimes in the entourage substances of cannabis, they also include alpha humulene, which is also called alpha caryophyllene. But these combined reduced an incidence of cell death, induced cell death by regulating this particular pathways for promotion of the death and destruction of these particular cells. And the STAT3 protein is involved in cancer progression. It blasted that, got that out of the way by reduce that. And the other mechanisms, the mix containing of cannabidiol, they created a special mix of cannabidiol and caryophyllene, and that they found that it was 5.6 times higher effectiveness than the regular compound, that contained only 1.9 micrograms of beta-caryophyllene and 340 micrograms of CBD. So you went to a one-to-one mix of the cannabinoids with the beta-caryophyllene, and you enhanced the effectiveness of caryophyllene in defeating this particular cancer. And what about THC enhancing beta-caryophyllene? Well, there have been a number of reports that beta-caryophyllene actually stimulates the effects and gives a higher high to THC, whereas it tends to resolve THC when it's taken at a later stage. So I've got reports on this where people have required much less THC in order to get the same level of pain relief, or they've actually come back high after they've mellowed and they've taken a dose of beta-caryophyllene, and it's elevated their height of their response. Now, I've theorized on a number of factors. Now, first of all, it could be lipolysis. Well, it turns out that THC, of course, is stored in the lipids, and beta-caryophyllene stimulates lipolysis. That could stimulate the release of THC and get a recrudescence of the THC high and get it more circulating in the body. It could also be the MAGL and FAH inhibition and stimulating the endocannabinoid system, the AEA and the 2-AG. That could be a possibility, but I don't think that would give you the high. And it also could be working as a CB1 heteromere. And that means that it combines in some way, combining with cannabis to create a combined CB1 receptor blend of BCP and THC that could have a particular high effect. And then finally, you've got the CYP450, and that does not appear likely to be a factor in an additional high. Still, we know that it does. It has been reported that THC and beta-caryophyllene foods have enhanced the high from THC. For instance, mango, broccoli, avocado, and grapefruit contain significant amounts of beta-caryophyllene, and these substances have been reported to enhance the high of THC. And this is a main difference we've got going on with beta-caryophyllene and CBD, is the FDA approval. So obviously, beta-caryophyllene is approved as a substance, as a flavoring, and as a topical agent, whereas CBD has yet to get that approval. Hopefully that will come in the near future, but there's lots of politics that are involved with that. And that creates a situation where if it's illegal, if it's not legal, there are lots of constraints on it, and we get into who can use it, who can't use it. So I get a lot of my information and a lot of my experience has been with my patients who have been using it. And I want to report this CBD, the cannabis comparisons that I've gotten on that. And I just want to read off a couple of these to give you an idea of what I've seen and why I'm relating this story, because it's not out there. It's not in the literature. This first patient, KJ, said she ran out of BCP and she felt more inflamed overall. And she's gotten back to the beta-caryophyllene, is getting her relief. And she's using more THC that has really makes me tired. So they're getting the side effects from THC that have been corrected with the beta-caryophyllene. And the next one says that THC requirements have gone down, and it's a perfect booster to my cannabis regime. So somehow it enhances the THC, effects for analgesia. So that I thought this was fascinating to learn about. And then the third one says that BCP is like 1,000 times what a CBD supplement is. It's better euphoria than any CBD that I've taken. Now, you know, everybody reacts differently to these cannabinoids, and I fully understand that. But this beta-caryophyllene could give you an option for somebody who doesn't respond, who's not responding totally to CBD or to the cannabis. And the fourth one there says that everybody needs BCP. And the final one said she usually didn't notice a difference with CBD, but she notices taking BCP. And adding the omega-3s felt dramatic relief of pain and symptoms in my joints. So combining with other endocannabinoid modulators could be a major factor in relieving these symptoms. So I want to get into the particular areas that I've found very, very effective for caryophyllene. In fact, my real introduction to caryophyllene was in retinopathy, where I used it for over a period of 4 months in an oral fashion, and it eliminated this diabetics, Klebsiella sepsis complicated endophthalmitis. It just corrected his diabetic retinopathy, corrected his endophthalmitis, and corrected his glaucoma at the same time in a 4-month time frame. And he's got a normal ophthalmologic examination at this time. And I've examined beta-caryophyllene specifically for the benefits that it can show. And it has been found to improve, well, I found it to improve acuity. So your visual acuity, improves macular degeneration, includes diabetic retinopathy, corrects for glaucoma, and I can only theorize that it's going to correct for cataracts. And the reason is that I've just listed off 6 of the inflammatory mechanisms in macular degeneration and the eye diseases that could play a role, where beta-caryophyllene blocks every single one of these in a profound way. So we've got this fantastic and potential anti-inflammatory and antioxidant and neuromodulator that is perfect for the eye, and you're taking it orally, and it has huge amount of effectiveness. But what about anxiety and depression? I've got these studies here, but what I hear from people are incredible stories of it relieving their symptoms of anxiety and depression immediately. Not waiting for a week, not waiting for a month, immediately relieving their symptoms. And I've got a couple testimonials here with after 1 drop of beta-caryophyllene. Well, that's an extreme. I don't usually see the 1 drop. She was smiling, beaming, and introducing herself to unknown people. Her entire countenance changed. And this other one said, you hit the nail on the head. The release of depression was almost immediate. She felt absolute relief of aching and stiffness, which is subsiding. And the third one says, got out of a severe grief-filled depression in nanoseconds. And the fourth one says that he had these complications with anxiety, depression, PTSD. 5 drops gave him immediate relief of symptoms that persisted over time and with recurrent dosage. So it has amazing instant measures that it can work with. And I don't completely understand this. And I don't think the literature explains it either. But we can only go with our experience until we can get those clinical studies that will report on what it's doing and how it's taking effect. And what about sleep? The general benefit that I hear consistently from users is that it improves their sleep. Now, this is also another vague area, but it appears to increase GABA, the serotonin receptors. It stimulates those. And it increases cyclic AMP. So it has all these metabolic changes as well as neurotransmitter changes. And the general emphasis is that there's a relaxation and a sedative effect that can occur with it quite quickly. And you don't have to take it right before you sleep. If you take it in the afternoon or the evening, you generally will sleep more soundly and deeper and with greater duration. But it won't make you sleepy. That's the paradox. BCP does not make you sleepy, but it helps you sleep. And what about mast cell activation? Well, this is a horrible condition for about 20% of the population, it seems like, with it seems to be a side effect and an adverse effect of COVID, and which it means that we're getting a lot more cases of it. The prevalence of it is probably about 15%, but with the COVID activation, it seems to go up much higher. And this is a manifestation of all kinds of allergies, but the allergies are considerable, and they include hives, they include irritable bowel syndrome, dry skin, reactions to anesthetics, and all kinds of allergic sensitivities, esophageal spasms, breathing difficulties, brain fog, angioedema. It's just a huge amount of suffering that can go on with this. Beta-caryophyllene inhibits the histamine-triggered edema and inflammation. It's equivalent to dexamethasone. And it inhibited anaphylactic-like shock and mast cell degranulation and histamine relief. So this has got huge potential. And I've actually seen it block anaphylactic-like reactions in a number of people, in 5 individuals as well. Now, it appears to work not only through the mast cell, but it activates the PPAR gamma, which has a critical role in mast cells. And the mast cells express CB2 receptors, obviously. They're an immune cell. They're going to have CB2 receptors, and there's going to be increased sensitivity to AEA and palmitoyl ethanolamide, an N-acetyl ethanolamide that is a food product that you can get as a food supplement, and you can find it in specific foods. Beta-caryophyllene causes regression of endometrial implants as well, and these are related to mast cells as well. So it's got a huge potential for mast cell activated disease, and it is a major complication of so many people in today's world. Now, most people don't know that they have mast cell activation syndrome. You're going to have to tell them. If they've got all of these list of allergies and allergic phenomena, then they probably have mast cell disease. And if they're 50% of the people with hyperflexibility, Ehlers-Danlos syndrome, have mast cell activation, actually. So you can check on these people and you can find out, and I've done this a number of times to make a diagnosis, preliminary diagnosis of mast cell activation in so many people. Well, what about weight loss effects? Well, this was a phenomenal discovery that I found out, again, by listening to my patients and hearing what they had to say, because I didn't really recognize it right away. Beta-caryophyllene affects the appetite, inflammation on appetite and other factors, addiction, and metabolism. So these are factors for effective weight loss, and these are factors that beta-caryophyllene specifically takes action on. First of all, the effects of glucose and fructose and sucrose on the peripheral appetite signals, basically it is upregulating hypothalamic CB1 receptors, and it's promoting an inflammatory situation in the body, and it's promoting appetite as well. And it's actually disabling some of the mitochondria functions in addition, as well as regulating many of the endocrine factors related to appetite. So I discovered this in for a number of people where people have lost 15 to 20 pounds in a matter of weeks without really trying. And the final patient I've had on beta-caryophyllene for a number of years, but she was using it topically, and she had a 45-pound weight loss in that amount of time, and she restored her body considerably. And so I was dying to really figure out what this was all about. And so I found this paper that deals with, actually, it was a study on the acute respiratory effects of obesity. So obesity produces large fat cells. The fat cells produce cytokines. Those cytokine substances actually feed to the lung and they create an inflammatory situation. Well, beta-caryophyllene affects adipose tissue, melanocortin, reactive oxygen species, and leptin, cytokines, adiponectin, and mitochondria and nuclear receptors all over the body. So first off, it affects the fat cells. It controls for the enlargement of fat tissue and the deposits of fat in that tissue and lipids in the fat tissue. And it also impairs the melanocortin pathway to the brain that introduces appetite stimulation. Plus beta-caryophyllene, and you see the BCP sectagonals in each of those positions. It's making a dramatic impression on the body in terms of the lung and the brown fat formation, as well as the mitochondria and the neurotransmitters, the nuclear transmitters, the nuclear factors, nuclear factor kappa beta, and the other factors that are NRF2, and a number of other different factors that are key and important for the development of obesity and appetite. So it really regulates appetite very, very well. It upregulates GLP-1 and adiponectin. It upregulates the pro-opiomelanocortin pathway, and that reduces food intake. It downregulates neurotrophic factor kappa beta and these cytokines, and it downregulates leptin as well. A lot of problems with obesity come from leptin resistance, and it creates a leptin sensitivity that reduces the need for and the function of leptin in the body, and it shifts the macrophage in adipose tissue to the anti-inflammatory phase of the body. Now, the role of CB2 receptor in the development of food addiction is key and important. There are misbalances in the brain in the reward system, and they're commonly shared with food and drug addiction. And CB2 overexpression decreases CB1 and opioid receptors in the ventral tegmental area. And I'll show you an image of that shortly. And CB2 has the potential of therapeutic target for eating control and the comorbid emotional effects associated with food addiction. So this is terrific that it has an effect on food addiction as well as the other factors in metabolic. So why do wild giant pandas roll in horse manure? Well, it turns out that they are actually getting beta-caryophyllene in the manure, and they're rolling it into our system, and they're activating, sorry? They're activating a TRPM8 receptor system. And CBD does the same thing, but it doesn't do this level and this level of activation. This is incredible. So these animals in cold weather are rolling in horse manure, and this is done in China area, and they are desensitizing themselves to the cold. Well, why does that happen? Well, it turns out that TRPM8 actually stimulates the formation of uncoupling protein. And uncoupling protein are the ones in our mitochondria that burn energy, and they burn heat and create a huge amount of heat. But it also increases our mitochondria but as well as decreasing the reactive oxygen species. So it's actually increasing the number of mitochondria, the amount of energy that it's putting out, and it's increasing the amount of heat that's being produced, and it's tempering their sensitivity to cold. And it's actually browning the white adipose tissue in the body. So the browning of the white adipose tissue is key and important for changing treating our obesity. And when you look at the factors that are involved with studies in weight loss, you'll see that they haven't done a whole lot with the calories, but it seems to be the changing of the mitochondrial function. Now, the beta-caryophyllene is a GLP. This particular study was a fascinating study that was looking at GLP versus beta-caryophyllene in mice and determined that there was compared with the Victoza at the time, and this was a 2023 study. They looked at 72 mice in 6 groups, compared weight loss, fat distribution, signaling molecules, and activated genes over 4 weeks. And they found that beta-caryophyllene had superior fat weight reduction. Plus, it improved the adipocyte hyperplasia and steatorrhea, steatosis. It improved dyslipidemia and cholesterol, and it reversed circadian clock genes in the liver that seem to be coordinated with a lot of metabolic effects. And finally, it's really CB2 activation activates the serotonin pathway, and signals PPAR gamma and PPAR alpha, and promoting a number of different metabolic effects from these particular features. So in summary, it actually offered superior weight loss effect over 4 weeks versus Victoza over 8 weeks. It's considerable benefit in this particular substance, where it reduced weight by about 10% in the particular model, versus the Victoza only reducing it by 3%. So it turns out that beta-caryophyllene works as a fasting mimetic. And this is my proposal. It's not discussed anywhere in the literature, because it also works as a ketone, as the way that ketones work. They both work in the same way. And I've listed off a number of different effects of ketones and fasting. So fasting is mimetic, is the idea is that you're actually going to reproduce the fasting effects of producing ketones, reduction in your appetite, and you're going to get the metabolic effects going on with it. So with the ketone and the ketogenic program and ketosis, well, beta-caryophyllene has all of the benefits of ketosis. And it has all the benefits of voluntary fasting mimicry, including gut microbiome changes particularly. Well, let's move on to addiction, because CB2, the beta-caryophyllene is superb for addiction. It's countered addiction in all substances, including food and THC. It blocks the pathway for the pleasure pathway for addiction in particular. And it's an enormous benefit in so many individuals. So we're actually stimulating endorphins, we're inhibiting methamphetamine taking, inhibits cocaine, nicotine, all these substances by working at the ventral tegmental area and stimulating the CB2 receptors there that go right to the nucleus accumbens, and they suppress any sort of dopamine release in that process. And by reducing and suppressing the dopamine release, they encourage, they suppress the addictive components. Now, those addictive components and those behavioral aspects go right up to the prefrontal cortex and the hypothalamus. And these are the prefrontal cortex, of course, is involved with executive functioning. And so it actually, beta-caryophyllene inhibits those abnormal impulses. It allows us for weighing consequences, and it relieves, it's reflective of decision-making in the prefrontal cortex area. And so you get this marvelous benefit, whereas it reducing addiction, reducing the pathway and the pleasure principle, but it does not relieve normal pleasurable situations. And finally, I want to get into cancer. Cancer, it has a unique ability to assuage cancer. Now, this diagram, it includes beta-caryophyllene oxide as well as beta-caryophyllene because they both have very functional capacity in cancer prevention and pain mediator release. Now, beta-caryophyllene oxide is a derivative of beta-caryophyllene. So if you're taking beta-caryophyllene, it's going to be broken down to beta-caryophyllene oxide originally, and frequently it's in the products that are available. So beta-caryophyllene attacks the cancer, it attacks the symptoms of the cancer, the pain may be related, and the dysfunction in the body that occurs with it. It induces apoptosis, it prevents proliferation, and it prevents angiogenesis and metastasis, all in the same measure. So it's an ideal substance for taking with a cancer because it protects the body and it promotes carcinogenesis. But it does more than that. It does so much more because it protects the DNA and epigenetic changes in normal cells, whereas it disrupts the DNA and mitochondria in cancer cells. It actually, with chemotherapy, it has the effect of concentrating, sensitizing, and enhancing the toxicity and creates synergy with chemotherapy agents, whereas it protects the body from the damage, the inflammatory damage that causes them. It modulates cancer receptors, enzymes, transport molecules, particularly CB2 and the PPAR receptors, and it inhibits angiogenesis and all the key factors that are related to cancer. So that's half. And the other half says that it controls cancer cell cycles, inflammation, and glutathione levels as an anti-inflammatory. It regulates the gut membrane permeability. It modulates oxidative stress and autophagy and glutathione again. And it reduces pain, anxiety, depression, and neurologic impairment. And it partners superbly with CBD. Now, in my mind, BCP should be an important role in all aspects of oncology, including prevention, adjunctive treatment, and symptom control, as well as recurrence protection. Well, to summarize, beta-caryophyllene is a natural herbal food substance that has a huge presence in most all of our healthy foods and herbs and spices. It's easily available, but you just can't get enough that way. And so what we've done is we've concentrated it into a formula that improves the bioavailability. BCP is broad spectrum cannabinoid working on all sections of the body, all working in all areas of the endocannabinoid system. It's FDA accepted. It's low dosing, few adverse effects. It's synergistic with cannabis, no question about it. And it offers an alternative to cannabis products in those people who cannot take them for legal reasons or employment restrictions. It's established, effective liposomal format that makes it highly, highly bioavailable. And so this is the potential applications for beta-caryophyllene in all these different areas. And it's actually been shown in some preclinical studies to have these particular benefits. Now, at Blair Medical Group, we offer 5 products in this line. We offer a capsule. We offer the liposomal form, the enhanced bioavailability. We offer gel for topical applications. And we offer the pure topical oil that can be used as a mouth treatment for tooth and gum disease, as well as topical applications. We offer crunches as well, and crunches are small cookies that are flavored that will give you a nice little boost at the end of the day if you're flagging, if you're losing energy, or if you have visual symptom and complaints about that time. And finally, I just want to thank you very much for listening to my topic. And the whole idea that we're trying to do is create balance and complement health through the endocannabinoid system. And any way we can do that. we're offering a full range of products for that purpose. And I hope that I can answer all of your questions with regard to it.
Dr. Blair, that was extraordinary. I think
Thank
people
you. Thank you so much.
that beta-caryophyllene is absolutely the sexiest cannabinoid terpene out there.
Well, if
Uh,
you want to get into sex, there does have particular sexual benefits to it.
a whole other grand rounds. Looking forward to that. Oh my gosh, just your mind's blown here. I'm just looking through the chat. Um, all right, excellent talk. People are really liking what you brought. In my Instagram post yesterday, I said you were going to bring the heat, and you did. So thank you for that. We're gonna go over a few minutes, and that's fine, folks. Those who have to hop off, you can at any time. But I definitely want to get to all these questions. They're solid. So the first thing I want to say is, back in 2018, for all of you who are familiar with the company doTERRA, there was a lot of pressure from their community to get into the CBD game, right? Because the whole CBD thing, blew up with the Farm Bill that year, and they didn't do that. Their response was to introduce a new oil, copaiba. And copaiba is a tree of lots of species, and on average, I think around 15 to 35% of the oil is usually beta-caryophyllene. It can be up to 60% in some oils. And I definitely bought some of that copaiba oil back then, but you shared with us that beta-caryophyllene is FDA approved. And most essential oils are not, right? They've had challenges getting essential oils FDA approved. So since that's the case, why aren't we seeing beta-caryophyllene everywhere, right?
I think it's hiding under the mask of cannabis, that everybody thinks of it, oh, it's a cannabinoid substance, therefore it comes under cannabis, and they're allocating it to the cannabis sector and the stigma of cannabis, so that it hasn't been appreciated. And then once in the cannabis area, then it becomes a minor terpene, and that's really only represents 1% of the substance, and it doesn't really offer that much. Where I don't understand why it hasn't been identified.
Yeah. Okay. It sounds just like a massive marketing, issue to me at that point. But yeah, so interesting. Okay, so the next question is around manufacturing, and I'm going to give it a two-part because two of our attendees had very similar questions. So first, Brian asked, how challenging is it to produce BCP? How stable is it? And Dr. Carmen asked, what is the process of isolating BCP? And what's the most common form factor? Tincture, edible, other. You shared the form factors that your products come in. But
Well, the best way, I think it can be extracted by CO2. It can be steam distilled, and it's available in every country in the world, and it's available in plants in every country in the world. It's just not extracted, it's not valued for its extraction, but it has enormous capabilities. I know that there are generous applications for the extraction from hops, from black pepper, from guava, and let's see, cloves. But those are the only areas where I see a concentrated extraction technique going on, and it's not being well incorporated. It's just not identified as being a valuable substance, and that's why I'm bringing it to the floor and trying to relate it as a valuable substance that could take the place, or it could partner with cannabis in a very effective way and independent of it.
partner with it, independent of it, depending on the consumers, right? Tolerability, whether that's stigma-based tolerability or actual like physical, biological tolerability, certainly. Okay, next, you had a slide talking about BCP as a fasting mimetic. For years, Knox docs were talking about the ketogenic diet and calling it a cannabimimetic one, for I think reasons you readily understand just based off what you shared today. So if we're going to position BCP as a fasting mimetic, if that's what it is, am I understanding correctly that consuming it could replace fasting as a lifestyle or
I
even
think it
as a
could.
therapeutic?
It could, but
Okay.
it really goes well with a low carbohydrate diet. I've not seen the degree of weight loss with a high carbohydrate diet or a vegetarian diet, but I have seen it with a low carbohydrate and a ketogenic diet. It suspends your appetite so directly, and then it increases your metabolism so effectively that you start burning calories. And you're not even trying. You're not reducing your calories necessarily. You know, the GLP-1 are said to reduce their appetite, and that's how they lose weight. It's more than that. It's actually a turn on of metabolism that occurs. And beta-caryophyllene is turning on your metabolism in a very positive way.
That's so cool because, ketone supplements became popular a few years ago. And so I could see this being something to
But you
use.
know, the whole idea of fasting is to create ketones that are going to act as a modulator for the body, a signaling molecule that are going to temper our appetite, change our metabolism, and shift it into high gear and burn up more calories, create lipolysis and burn off fat tissue. That's exactly what beta-caryophyllene does. Now, I don't have any proof that it actually increases ketones, but I think it's only a matter of time before you have that evidence.
That could be studied. What would you say to someone who does intermittently fast or, does any other fasting cycle when
Well,
consuming?
I'd like them to try it and find out if it does, if it makes a difference for them. And I've actually used it in a number of people who are on a ketogenic diet, but they've stopped losing weight. One lady was stuck at 250 pounds. She was on a ketogenic program. I don't know exactly what she was eating, but she was supposedly on a ketogenic program. She started taking the beta-caryophyllene. She lost 10 pounds right away within a
Wow,
week.
so her break her plateau.
Yeah.
Okay, that's cool. Good to know. All right, now we're going to get into a clinical question. So what is your clinical approach to starting and then counseling around management with patients? Is there a particular introductory dose for wellness, right? Using it as a supplement versus as a targeted therapy? And Bonnie Goldstein asks, have you treated any children with BCP? Also, what is the range of dosing? Does it differ depending on condition or age?
Well,
Thanks.
you've asked me a dozen questions in that particular sentence. The dosing, I have a protocol that I generally, and it has such a benign effect that it can be taken in any quantity and at at any dosage. There's no significant side effect. The worst that you can get from it will get fatigue for about an hour or two after you take it, get a sort of sedation sort of effect. But I generally like to start people at 15 milligrams, which is a half a milliliter of my product, which is 30 milligrams per milliliter. So a half a milliliter, 15 milligrams, is an effective starting people for most people, particularly for those people over 60 and for people under that age and animals. And so it works really well. For a child, I've treated adolescents, but I haven't treated any children directly. Now, when we were in Mexico, Juan Alvaro's, he was treating a number of children with epilepsy with beta-caryophyllene in addition to the CBD that he was using. He was treating over 400 clients at that time. And he would use it as a topical agent to inhibit actually status epilepticus, and you put it on the nose and the application, and it would eliminate, it would control their seizure at that time. So I know it has particular excellent properties. I know it can be used in children. There's no reason why it can't be used in children. And I've used it in autism very effectively for an older autistic. Now, generally what happens with the older autistics is they've been on CBD for a while, then they start to get, there seems to be in many of them, they developed an anxiety sort of reaction. They get aggressive and physical. Beta-caryophyllene can reverse that particular attribute, and they can get back under control with it. So for children, I would reduce the dosage by half of that for make it maybe 6 or 8 milligrams. And for certain people who are really sensitive to substances, and I get that with mast cell activation syndrome, oftentimes I can just use 5 drops in order to reverse their symptomatology. And I'll tell people to take it twice a day But if they need more, they can take more, and they want to optimize their performance with it. I tell them that I'm not looking for a drug effect. You're not going to get anything. You're not going to get high from it. You're just going to take away those kinds of complaints that you often have, those aches and pains, those mobility issues, those cognitive flares, and you're just going to enhance your vision. And it's all going to take place in a matter of minutes. So I've got a 10-minute self-assessment that I run people through that I can tell immediately how they're going to benefit. But if you don't respond, then if you don't respond to 15 milligrams, then I'd double the dose right away to 30 milligrams and see how you would do with that. And then I tell them they can take it 3 times a day. You can even take it 4 times a day, and it has no ill effects. It improves your sleep and it improves your well-being, and it acts as a superb anti-inflammatory.
And what's the duration to response that you're looking for? Like that day, the time you take it within 30 minutes, or are we talking about giving it some time, like a week to 30 days to take effect?
Well, most people get a response within minutes. I say within 10 minutes, you should have a positive response to it, where you have visual, you have relaxation, calmness, you'll have vocal formations, you'll have breathing easier, relaxation. So it's amazing that it opens, and that's about 70% of people. But some people, they don't seem to respond to that, and that may take them a week or so before they will register it in their bodies and they'll recognize the anti-inflammatory effects that it has. Many people actually get on the drug, get on the beta-caryophyllene for a couple of weeks. They just say, I don't notice any benefit. And then they stop it, and wow, they realize that they were getting benefits from it.
Do you, okay, let me.
So it has about a 12-hour effectiveness, but there's lots of variability, and it could be 24 hours. I have people taking it once a day. I have people taking it every other day. I have people taking it 4 or 5 times a day. Well, 4 times a day.
Okay. Good. A lot of people had dosing questions, so thank you for being so thorough with that. I hope everyone got their questions answered around that. I'm going to switch gears here a little bit. Here's a question from John. Is there parasympathetic versus sympathetic nervous system differences in effect depending on method of administration?
There's no difference in the effect on the way it's administered. One in particular is, and it's not really well documented, but it dampens the sympathetic response. Very specifically, it dampens all of the actions of adrenaline and cortisol, whereas it instills a vagal effect on the body. So an enhanced vagal effect in the parasympathetics versus the adrenaline and the cortisol and the anxiety that you can produce from the sympathetic effect.
Okay, thank you. And how about this one from?
Well, I want to go back to that. You can take this topically as well as orally, and it has particular benefits in both ways. I treat some people as applying the topical oil just to the skin, and they get enormous benefits. And I use it before I go to as I go to sleep at night, and I get a particular relaxation from that.
Well, since you said that, Robin asks, would taking BCP along with a THC gummy help provide more restful sleep for someone with autism? And then you kind of answered this already, but I'll finish her question. What would be the dosing guidelines for an adult with autism?
For autism, I would start with a standard dose. Oftentimes they're pretty sensitive, and so you could start with 5 milligrams or 5 drops or 5 milligrams and work up. I would be cautious with them, but they end up taking about a standard dose, which is about 15 milligrams. They do well. In terms of THC, if you want to use it, that's fine. I would start low and go slow and advance it depending on the situation. Beta-caryophyllene has superb sleep qualities, so you may not need to use the THC, or you may use it in just low doses for most people who need better sleep.
Yeah, and I think that's wise anyways. THC is highly effective for many, many reasons, but if you could get more with less, why not? A lot of indirect, benefits, and certainly one being the cost, right?
Right.
That makes a lot of sense. Cannabis nurse Wendy asked, could you overdo BCP and alter FAAH significantly enough to create problems?
Well, I haven't seen it. In theory, you could, but it hasn't been evident in any of my experience with it. So you can take, if you took a lot of BCP with a THC load, you're going to get high, no question about it, and you're going to get an excessive high. We found that out at a conference we were at. People were a white label conference. They were coming by and they were taking samples, and they were going really, they were blitzing out on THC from their other sources, not from us, but from our other sources that were using it. And we've got reports, and I showed those reports where people have had to reduce their dosage of THC. They get the same level of benefits, but they don't get the high. They want to reduce the high effect and the impairment that they get with it. So they're going to reduce their THC by 30, 40, 50%.
Significant. Oh, okay. Any data on pets in BCP? And thank you for
Well, I'm talking with a pet pharmaco manufacturer right now, trying to get them interested in it, but it's the barrier. They don't want to believe it. They're ultra conservative, just like most physicians are, and it's very hard to penetrate. But they're interested, and the evidence that I've got from my clinical experience and applying it to dogs and cats, and I think it has superb effects from it. It creates a sedative effect if you give it in high doses, but at a lower dose, it improves socialization, it improves mood, it improves behavior, it improves friendliness. And so these animals who have been yipping and snapping at other people and biting at other people calm down and relax, and they socialize with other people and other animals. And the dosage is about 1 milligram per 3 pounds.
Precise. Thank you, Dr. Blair. Okay, let's see. This is a good question from Alex. What kind of concerns do you have regarding the extraction process or the presence of toxins like mold or residual solvents or heavy metals?
Well, I'm relying on manufacturers who do this, and it's coming from a pure product, and I guess I would hope that it would be organic, but I don't know that my products are actually coming from organic produce. I know that the liposomal one is coming from an organic producer of cloves, so that's in particular. You certainly have to be careful about those kinds of things, but we do testing for heavy metals and for bacterial content, and we guarantee that that doesn't have any of those substances in it. And you just have to go with the confidence and the production capability of the manufacturer and the reliability of the manufacturer and what they are producing.
Same thing we say for all cannabis products. Seems okay. We're closing in here. I think we can get everybody's questions in. So I'll cut to the chase. Nurse Wendy asks to please comment on the potential usefulness of BCP in treating 3 conditions here: Charles-Bonnet syndrome, visual hallucinations in patients with vision loss, head injury, and COVID cytokine storm.
Well, first of all, it's a superb antioxidant, anti-inflammatory. So it's going to be very effective, and it has so many vascular benevolent effects as well as, and it blocks the fight or flight syndrome. So you're going to get a magnificent effect for a COVID phenomena. And I think that it would be superb. And any inflammatory brain disease, so neuroinflammation is going to be very corrective and repeatedly effective for. It's been effective in stroke. It's been effective in myocardial infarction in animals, not people, but it's been superb for ischemic type of reactions where the body is reduced the blood supply. So that's key and important. For visual loss, it depends on what the visual loss is. If it's macular degeneration or something like that, then there's a potential. I don't think there's a real good potential for reversing macular degeneration from a vision loss, but you can stop it, and I think you can protect the eye from it. And I've noticed that I've made some significant improvements in macular degeneration and glaucoma with it. In terms of hallucinations, I think I haven't gotten it into any schizophrenics. I'd love to get it into a schizophrenic. I'd love to find out if it could be effective because it's working at a CB2 receptor level. It's not going to come into conflict with anything except for it's going to upregulate the endocannabinoids. That could be a factor in it. But I don't see that as being a major problem in the body. And for the epileptic syndrome, it has been studied in models of the epilepsy syndrome, and it's been very, very effective. It hasn't eliminated the epilepsy. It actually requires very high doses to eliminate, to work on its own, but it works in partnership with other substances very, very effectively.
Amazing. Thank you. Thank you for that wonderful answer. One more therapeutic target question. What kind of dose is used for weight loss?
I would use this as standard dose, it's 15 milligrams. But if you didn't get the response that you were looking for, I'd up it to 1 milliliter twice a day. One milliliter being 30 milligrams. So if you're overweight, and there isn't really a bearing on weight, and I don't want to go by milligrams per kilogram, but because it doesn't seem to register. It's a lot like CBD, and I use CBD, and you can be across the chart in terms of body mass and the dosage, and so it's all independently found. But in general, I use about 1 milliliter. 30 milligrams twice a day is adequate for most people, and I see a significant weight loss if they are on a low carbohydrate ketogenic diet.
Important. Okay, and then
Great.
last question. We got a couple people asking if slides will be available or are they proprietary?
No, they're available. I'll get them out.
Your
Do I
last
give them to you?
info, that's totally, that works. If you're okay with people contacting you directly.
Sure.
This presentation, everyone, will also be available for about 2 weeks from today, so over a 2-week duration. So absolutely come back and replay it and take notes. There was a lot of valuable information shared. I mean, groundbreaking information, information that, yeah, we got to get out to the masses about this molecule. And that's it. That was our last question.
Well, thank you so much for all these wonderful questions and the opportunity to present to such a valuable and resilient group. I was really impressed with the questions and the interest that people have with regard to beta-caryophyllene.
Absolutely. All right. Well, everyone, this concludes our session of Cannabis Grand Rounds this month. Again, thank you, Dr. Blair, for this absolutely necessary discussion about our favorite cannabinoid terpene. Thank you to the audience for joining us today. Thank you for being so live in the chat and bringing forth some really great questions for Dr. Blair. We hoped you learned at least one new piece of information. Please help us in continuing to grow Cannabis Grand Rounds as well. So if you felt like you received something valuable today, please come back next month. Please share Cannabis Grand Rounds with, your family, your friends, your peers, your patients, everyone. We really are trying to increase the cannabis competency, the competency around cannabinoids and endocannabinology, full stop. And this is I think we believe one of our most effective ways of doing that, getting people into a space where we get to dialogue about the literature, about the data, about real life experiences with these very benign and very benevolent substances. So we hope to see you next month. We'll have Dr. Sophia Lynn Lassiter here, and she'll be leading us through a discussion on THC-infused beverages. You won't want to miss that. And we have more dynamic speakers joining us in the upcoming months as well. Hi, Dr. Bonnie, saw you here today. So be sure to mark your calendars because we'll be welcoming her in April, on April 18th, and followed by Dr. Dustin Sulak. So we're just having heavy hitters, one in a row, one after the other. So we look forward to seeing you at our next Cannabis Grand Rounds. And lastly, we always invite you to come visit our website pivotaledu.com to learn more about us. And again, if today's session was remotely valuable to you in any way, please share our information forward. I'll see you next month.